Answering questions. After our last post, we've got a ton of questions. Probably the biggest one is, how are these endotines different from threads? Well, they are completely different. Number one, they are placed using the endoscope. Very significantly, what that means, you can make your small little incision right up in the brow area, up in the temporal region, and you can introduce this, and now you're up underneath the skin, and you can get down underneath the SMAS, which gives you better visualization. And once you're there, now you can deploy these, and they have about 20 different little prongs or hooks on them, or endotines. And so these are very different than threads. Number one, they are placed under vision. Number two, they give you the direct vector of pull up superiorly. Number three, they're absorbable, and they are much more controllable because you are down underneath the SMAS, that superficial musculoaponeurotic system that gives you that superior lift that patients are looking for. They're saying, hey, I want that lift, and I want that lift to stay. One of the troubles that we had with threads a long time ago was that they were permanent, and these caused all kinds of problems. So many patients have seen a movement by their providers to absorbable threads. Then again, the problem with those is their lift can be very temporary and short-lived. What you're going to get with the endotines is a much more durable, long-lasting lift that is in the orientation and direction that the patient is asking for. Other questions that I've gotten are, what do you do with all the excess skin? This is why it's so important to go to a provider who does deep plane open facelifts, so that, as I describe in the continuum of the ladder of care, or the aesthetic ladder, that you can move to a higher level or to a more comprehensive level treatment if you need it. If you have a significant amount of loose and excess skin, you might not be a candidate for an endoscopic midface lift. Now, you could be doing it in conjunction and really cutting down and minimizing the scars. I think that a scar that's very reasonable is along here, here, and here. I'm not a big fan of a big scar going up here. I like to avoid that because when a patient pulls their hair back in a ponytail, then that scar is very visible. The endoscopic procedure can be used in conjunction with the open technique. Sometimes you can avoid this incision entirely and just do an incision here and then the incision back behind the ear. And that's, again, very attractive because no incisions around or in front of the ear, which is sometimes something that may be noticeable. We've made a lot of really amazing innovations and advances so that even these scars are barely noticeable. But sometimes patients come in and say, look, I don't want these scars at all, in which case we would combine the endoscopic brow and midface lift with the incisions down here, and that allows me to go down and do all the deep neck work that needs to be done. It's really a customized operation, really not one operation fits all. It's what is the patient looking for? And many times patients will come in and say, Dr. Claytor, I want this addressed. Okay, let's give you these different options. But there are times when patients will come in and say, Dr. Claytor, I would like to do this and I don't want any visible scars in front of my hairs or around my ears, in which case that's where the endoscopic midface operation would be perfect for you. Hope you found this helpful.